Hey guys, welcome back to the Proactive Lifestyle Series. I know we've had a few weeks without videos here, primarily for the holidays and just kind of get caught up back here in the office. A couple weeks ago we were talking more so about chronic and acute low back pain. Today what I want to discuss is more neck and shoulder pain, which will then lead us into talking about headaches and things like that. So typically we get a lot of people presenting in here with just the chronic tightness in their shoulders. They always say they carry their stress here in the shoulders, and which leads into them having neck pain. A lot of that stems from is just simple posture and simple breathing techniques. So today that's kind of what I want to discuss. What we're going to talk about is how can we correct the posture a little bit, and how can we change our breathing habits to lessen the load on the muscles of our neck and shoulders. Typically what you see with people is we have a postural position of shoulders forward and head forward. So you're kind of rounded over here. So what we want to do is we got to try to correct that. And most of us are taught to, hey, pull your shoulders back. So what we do is we sit here and we pull those shoulders back. Typically what that does though is that creates just a lot of dysfunction here in the shoulder and tightness in the mid-back. So we don't want to just jam those shoulders back. We want to work on elongating our spine a little bit, which we'll talk about here in a second. Another big key is breathing. So what we see a lot is if you tell somebody, hey, take a deep breath in, first thing you're going to see, they take a breath in, that chest really rises and really expands, okay? What that does is I do this, what does that do? That requires all these muscles here to pull my rib cage up. So that creates a lot of chronic stress in the muscles of the neck and shoulders. So we want to try to do away with that as well. We change that by trying to activate the diaphragm, using our diaphragm to breathe, what we call three-dimensional breathing. So as we breathe in, we should feel expansion in our belly, into our back, just kind of all the way around. And it should be lower, kind of the lower part of the rib cage is what we want to focus on. So if we're looking at trying to first just address the posture and breathing, what we're going to do is, from a side point view here, you can see if I have kind of the normal posture, what I'm going to try to do, instead of really pulling my shoulders back, what I want to do is I want to pretend like I am lengthening my spine. So it's like I'm getting pulled up in the backside. So if you see, if I'm kind of standing normal and I pretend like something's pulling me up, you'll see me kind of lengthen my spine, which is what we want. We want to keep that position, okay? So we want to keep ourselves nice and tall. That really works the muscles of the upper back to strengthen them up to keep us in this upright posture. So after we upright ourselves, what we want to focus on is widening the shoulders. Not necessarily pulling them back, but what we want to do is pretend like we're getting pulled apart at the shoulders just straight out. So if I'm standing here, I'm going to correct my posture, be tall, and I'm going to widen myself. Now the widening, you don't really see a whole lot, but you will feel it. Once you widen yourself, you can feel the muscles in your back working, try to widen your back, okay? And I said, as we do this more and more, it's going to strengthen those and retrain those muscles to keep you in the proper posture. The third thing here, after we elongate and we widen, we want to look back at what I was talking about earlier, the breathing. Because as soon as you go to pull yourself up, you're going to feel your back excessively arch, and you're going to feel the pressure in your back. So what we have to do is we have to come back down to the core here and kind of line our rib cage up over our pelvis again. Because like I said, as soon as you upright, you extend back like this, the rib cage sticks out. We need to basically pull that rib cage back down. So if we elongate yourself, widen the shoulders, and then reestablish control of the diaphragm here. And our focus here is when we're breathing, we breathe in and out through the lower part of the ribs. So if you can start focusing on trying to change your pattern of breathing from accessory breathing, which is when you use the accessory muscles up here to lift your rib cage, to diaphragmatic breathing, which is how we're intended to breathe, that will change a lot of tension, or reduce a lot of tension in the neck and shoulders. So start working on trying to pay attention to having a relaxed belly, breathing through the diaphragm, not through your shoulders and chest, and also trying to focus on the concepts of kind of elongating the neck and the spine, and also widening out your shoulders. If you can focus on those few simple tasks, you will see a reduction in the amount of stress and tightness in your shoulders. You know, it seems like a weird concept to retrain yourself how to breathe or retrain yourself how to stand, but from what we do day to day, most of us are either at a computer, we're bent over a table, bent over at a line at work. I mean, we're constantly in this forward position, so we have to start focusing on realigning our bodies and retraining our muscles to keep our body where it needs to be. And if we can do that, it's really going to help reduce the pain and the tension in the neck and shoulders. Stay tuned. Later this week, what I want to talk about is how that relates to headaches, migraines, and how TMJ gets involved with all this as well. So again, like I said, we're going to start kicking off talking more about the head and neck and some headache issues. But yeah, come in next week, see how it goes. Until then, try to focus on the posture, and we'll see how things go. Thank you.